Hi, my name is Josie and I'm from the Centre of Rural Health at the University of Tasmania. We are doing a project looking at youth engagement in Tasmanian mental health services.
So we are looking at some of the reasons why a young person decides to access a mental health service, as well as some of the barriers that prevent them in doing so.
This project stemmed from an evaluation we were originally doing with Headspace of their clinical pathways and how easy it is for young people to access their services. So what we were finding and hearing from the staff, as well as through the literature reviews that we were doing, was that young people either weren't accessing the services or they were accessing and then prematurely leaving. So what we're wanting to do is find out how to get young people to access a mental health service earlier and then how to best support them to stay engaged with the mental health service. So the research is looking at that for young people to get the best outcomes, they should be accessing a mental health service earlier, and that they also need to access it for an adequate amount of time.
So we are talking to mental health stakeholders in Tasmania, so particularly those working in the fields, as well as parents of young people. Though there has been research which has looked at youth engagement, there has been a lack of the youth perspective within this.
Our main aim throughout the project was to get as many young people to come and talk to us about the project.
We are wanting to talk to young people who have accessed a mental health service, those who have accessed a service and left, as well as those who have thought about but have not currently accessed a service.
I guess some of the things that we've been hearing from these young people is they didn't know when they should access a mental health service. So they might be thinking that some of the things that they are feeling or experiencing are normal, and that could be even coming from their parents or friends thinking, oh, you'll get over it, that kind of thing. And so they were leaving it till it was getting to the really severe stage. And a lot of young people are thinking that they should be able to deal with it themselves. And thinking that their problems might not be as severe enough.
So there have also been some recommendations, such as educating young people earlier about when they should be accessing a mental health service. We are currently completing data collection and are hoping to finalise a report early next year. We will be then distributing the report to Tasmanian mental health services, who hopefully can use it to help make their practice more flexible and adaptive to the needs of young people.